So I think apart from postpartum depression, another thing that's quite common is postpartum anxiety. Sometimes the husband will be like, oh, it's not that bad, but that's really just not the right thing to say.
So don't ever say that to your wife, okay?
Yeah.
Some mummies actually then report concerns, like for example, I just really don't want to wake up tomorrow.
And I have seen some mummies with traumatic kind of birth stories, and they have nightmares about it, and it affects their quality of life, and sometimes they do fulfill diagnosis of post-traumatic stress disorder.
And welcome to The Birth of a Mother, a video podcast series by Clarity Singapore. We are a mental health charity that serves individuals from all walks of life. And this series is a Clarity for Mums initiative where Clarity's ex-clients share about their lived experience with postpartum conditions. We're starting to see more cases of mums struggling with postpartum conditions. And we have heard so much, about the infamous baby blues by now. But what exactly is maternal mental health? And just how common is it? What can we do about it? Well, our special guest today will answer all of these burning questions, so buckle up and get ready for the ride. Let's welcome Dr. Jayen Lim. Gillian works as a psychiatrist and she is the chief of the Central Region at the Institute of Mental Health. Dr. Lim is also a passionate advocate of maternal mental health, and she's the one who set up the perinatal mental health service in IMH back in 2018.
Yes.
Right. Okay. As a senior medical professional, Dr. Lim is also involved in the teaching as well as education of students and junior doctors, and an advocate about the issue of abuse and harassment of the healthcare staff at IMH. Most impressively, she is also a mother of not one, not two, but 4 kids. Okay, so Dr. Jayen, I'm going to hand the time over to you.
Thank you very much. I'm very happy to be here, and we're talking about something which is, of course, something that's very close to my heart. And I was really amazed at the topic title because I love puns, and I thought that was really good as well. So I've had, the marvelous opportunity to be working in maternal mental health even before I became a mother. And I would say what I had in terms of my preconceptions, and then what I had with my number 1, 2, 3, and 4 babies really changed who I was and how I practice my medicine as well.
What inspired you to start the service then? I mean, you were in the field from before you became a mom, and you're still at it now, right? After 4 kids, what continues to inspire you?
So I think going through the day-to-day struggles of, juggling being a mom and then trying being a wife, a daughter-in-law, and, all these things come together. I think it's very important to have these conversations with my patients so that they know that they're not alone, that their struggles are everyone else's struggles. And sometimes being that person to be able to tell them, hey, it's okay, really does make a difference. And I feel honored that I get to do that for my patients.
It's so comforting to hear, like when you seek help at a hospital, you're not only meeting a doctor, you're also meeting a fellow advocate and a fellow mom.
Yeah. But I think through today's topic as well, I hope for people to realize that to seek help does not necessarily meaning seeking help from a hospital or a doctor or a psychiatrist. It could be, a counselor. It could be a church pastor. It could be a best friend. It could be a neighbor. It could be Clarity as well. And all of these are good sources as long as you ask for help. I think that's the most important thing.
I love it. Right. It's unrealistic for people to only want to seek help like professionally as well. Why not? We take a few steps back, and why don't you tell our listeners and viewers what exactly is maternal mental health?
Okay, so maternal mental health is the mental health of a mom. This may be a mom who's pregnant, who has baby, who may have experienced loss, who's having fertility issues, and it's really looking at their emotional, social, and kind of like overall well-being. So it's not just physical health, and I think that's the important part of it.
Yeah, thanks for emphasizing that. We do have some moms who come in after baby losses, and they struggle to even use the term maternal mental because they feel like they don't fall under that spectrum.
Yeah, I think that's very true, and I do see patients as well, and some of my friends as well who have had losses, I think, experience this. But I think so long as you have that image of being a mom and you've had that baby, that's still a baby to be counted.
Right. Yes, thank you. Right. So listen up. Even as long as you've been through the process, whether or not you do bring home a baby at the end of the day, you are a mom in your own right.
Yes, 100%. Yeah.
Could you share with us and our listeners how is the perinatal mental health service actually different from seeing a regular doctor?
Okay. So I think the perinatal mental health service and services that specialize in maternal mental health like Clarity are able to provide a somewhat different experience, because a lot of times when you know a subject matter, you know the population, and you know the patients well, you're able to individualize plans more specifically for them. And these could be things like just telling them, hey, I think this one for breastfeeding, you may want to try a different latch, or perhaps you want to try another type of breast pump. I mean, these are things which just come through experience from talking to people, and being able to give them what they require that may help them. I think it gives that pizzazz that perinatal and maternal mental health does. Yeah,
it's like being able to kind of relate to where they are at, and also go through that whole process of trial and error.
Correct. Yes.
Right.
Yes.
Because it's not one size fits all.
Exactly. Yeah.
What about postnatal blues and like feeling sadness or just crying postpartum? But then there is also postpartum depression.
Yeah.
Right. What is the difference?
So I think the symptoms are, in terms of like just, the crying, the feeling low, the poor sleep, the hormonal changes, the mood swings, they are fairly consistent. I think what's the main difference would be how often the symptoms come, how severe the symptoms are. So I would usually ask my patients and ask them like, okay, if you are feeling low, is this consecutively for a few days? Is it something that's almost the whole day where you feel that way? Are you able to still experience joy in between the sadness? And if the answer is yes, then there's a high chance that it may be postpartum blues, because we know that it occurs in about 80% of mummies.
Yeah.
But if it's something that has happened over like a few days to 1 to 2 weeks, the whole day they just feel very low, they really can't experience any joy or happiness in between, I think then that's when they may want to seek help.
Yeah, it's like with postpartum blues, even if you feel sad or frustrated or down, there are still moments in between where you get to appreciate the bond and the connection you have with your child or with your husband or family.
Yeah. I think that those are important parts. And sometimes the mummies will ask me like, oh, when should I particularly feel joy or happiness and all of that? And I think that, it can be quite a scary and stressful experiences, but in general, I would say that sometimes, it's those little moments, right? When you're like, exhausted, you then sleep at 2 a.m. But then when you smell your baby's hair, or you like look at the little toes and you want to like chew on it. I mean, those are
Have you tried that? Just secretly?
I have actually.
Okay.
So those are periods where actually you feel this overwhelming sense of like calm, or like this right feeling in the world. And I think it may not necessarily be every time, because when I had my firstborn, and it was a really stressful kind of whole pregnancy. I was like alarmed that, it was nothing like what I had Googled before. And then when they passed me the baby after like days of labor, I was just feeling like, oh my gosh, I hope I don't drop the baby. I hope I don't drop the baby. Oh, the baby looks like, okay, got 5 toes, 5 fingers. 10 toes and 10 fingers.
One side, actually, you're looking at one leg. Correct.
Yeah. But then you just feel like, okay, I think everything's good, but you're just so tired to feel, that bonding, that warmth, that fuzziness. So I was just like, okay, maybe something is a bit wrong.
Yeah.
But I realized with experience that sometimes it may not happen at that immediate moment, but it can come later. Yeah.
I think what you're describing is really something that we do hear quite commonly with our clients and mummies as well, right? The inability to feel joy, or to feel like you can have anything more than just panicking about the next moment, or worrying about what to do next.
Yeah. But that is very normal, panicking and saying, oh my goodness, what do I do this tiny little thing who needs me to do everything for it? Yeah.
Sometimes my clients come over and they ask me, is it treatable? Right? Postpartum depression, and like what's the difference? Is it more treatable than major depressive disorder? Like, what is your take?
Well, I would say I do have patients who, have only that first episode, and it's related really just to the pregnancy and the postpartum. Of course, I have patients who have a history of depression before when they come. I really think it's about, sometimes the hormones. And if it's really hormonally weighted, sometimes that has a better prognosis, in the sense that, okay, once, this period of sleep deprivation and hormone fluctuation kind of goes away, they do feel naturally much better.
Yeah.
But of course, depending on the stresses that occur for a new mummy, sometimes that stress may then kind of continue if we don't address those things. So I would say prognosis is quite good regardless. And that's the same for depression. It's just a matter of getting the right help and getting the right support that you feel you need.
Right. Is there like a time period for when the hormones are supposed to reach equilibrium?
I would say from personal experience, some medical school knowledge that some still sticks in my head. I would say I think the first 3 months is clearly a really, really tough period for everyone.
Yeah.
The first 4 weeks being the point of time where the hormones really drop the most first. But then that hormonal change can also kind of be there if you are breastfeeding, if your periods don't come back. So sometimes it can last up to about 6 months or even more. Yeah.
Okay.
And I think also as the baby grows bigger, and new challenges with movement, with feeding and weaning come across, sometimes mummies will be fine for the first few months, but then subsequently develop postpartum depression still.
So this point is pretty important. So mummies, if you're hearing this, it's not going to be clear immediately after birth that you're struggling with distress or you're struggling with some things. It may take time to kick in. It may fluctuate as well, right? Do look out for some of the signs, whether you're able to enjoy your connections, whether you're able to enjoy your time with your loved ones. And if it's always so bleak and dark all the time, that's really not how motherhood is supposed to look like, and it'll be so hard for you if that's the case. So reach out.
Correct. I think when that happens, and whether it's the patient themselves or even family members who feel that something is just off, I think it's important to just seek help. And seeking help again can come in many forms. It could just be speaking to a religious leader. It could be speaking to a general practitioner or someone you trust. It could be speaking to services like Clarity again, or family service centers, and even calling helplines. Whatever it is, just asking for their help, I think, is the first step.
Okay. We often hear, even now, like our topic has mostly focused on postpartum depression. But postpartum conditions go beyond that.
Yes.
Right? What are the other commonly seen postpartum conditions? And what are some of the signs of those?
Okay, so I think apart from postpartum depression, another thing that's quite common in Singapore is postpartum anxiety. And usually the anxiety is related to baby, your cleanliness or health. It kind of worsen after COVID, understandably so. And within that spectrum of postpartum anxiety could be, just regular panic attacks. It could be obsessive compulsive disorder. And usually those patterns of thoughts will be like, oh, am I cleaning enough? Do I have to wash the bed sheets or wash the items 4 or 5 times? Are people's hands clean when they touch my baby? But it also could be post-traumatic stress disorder. And I have seen some mummies with traumatic kind of birth stories. And that makes them kind of be very fearful, and they have nightmares about it, and it affects their quality of life. And sometimes they do fulfill diagnosis of post-traumatic stress disorder.
Yeah, thanks for sharing that. I mean, a lot of times we kind of expect pregnancy to be something so beautiful, right? It's the best experience of your life. But after spending so many hours on that bed, on the labor ward, I think it's like it can be very traumatic.
Yeah, I mean, I can share a personal anecdote. So when I had my first one, whose head was bigger than, I think, like 95 percentile, and he was in the wrong position. And of course, being the first time mom, your pelvis is really just not stretched out as much. So it was a really difficult labor, and he required a very prolonged period. They tried to vacuum and take him out twice. That failed. And then they tried one more time of forceps, and that failed.
Oh, this is like almost everything.
And they were like, okay, Gillian, this is the last time, this is the last forceps, and if we fail, it's going to be a crash cesarean section. So it was obviously very traumatic. And by the time he was, pulled out, I had a huge tear, and it took me like 8 weeks before I could sit my butt normally on a chair without being in pain. So I think overall, it was a really traumatic experience. But sometimes kind of sharing that experience with my patients and letting them know that, hey, it's okay even if you had something which was not your birth plan. It was not something that you imagined it would happen. But it doesn't mean that, number one, you are weak for being upset about it. I think it's perfectly normal. But number two also is to accept that some things are beyond your control. And if it's beyond your control, yes, you can feel a bit of sadness and grief from it. But also it's important to try and seek ways to move forward, because now is the present, right? And we want to make sure they live in the present and not think back too much about the past.
What does that moving forward look like?
So sometimes it's about talking, kind of just ventilating and having the catharsis of someone saying, yes, you really did have a very bad experience.
Kind of making sense of
Correct.
it as you
and
talk,
just validating that it was really terrible. Because sometimes the husband will be like, oh, it's not that bad. But, that's really just not the right thing to say. Because you're not the one who's,
So don't ever say that to your wife, okay?
Yeah. So, I mean, I think just validating and hearing their story is one of that process. Sometimes it requires something a little bit more like therapy, where they are allowed to kind of share on it multiple occasions. And we realize that sometimes when you have a traumatic experience and you have that control taken away from what you previously hoped you would have, it then also kind of routes back to past incidences that their control were taken away. So I think sometimes therapy helps to resolve some of those issues. And of course, if really it's to the point where regardless of all those other interventions, the symptoms are still persistent and they can't let go of certain things and it's causing them depression or anxiety, then we have no choice but maybe to just say, hey, do you want to try a bit of medications to get through that period?
Yeah, and sometimes medications really help, even if it just lowers the distress enough for you to receive therapy, because therapy is a long-term work, right? Like, it takes time, right? So it's great that it goes hand in hand.
Yes.
And it doesn't mean that you are weak just because you receive both. I was wondering if you could share with our listeners what are some of the signs of postpartum trauma.
Okay. So I would say that the common signs will of course be the most common would be the anxiety and stress. Every time someone brings it up or asks like, oh, how was your delivery? And you feel really just kind of stressed out, you feel your heart racing, you feel as if you're like, seeing a lion or something like that and you're tensed up. That would be quite a common symptom. Another thing that people will talk about is the avoidance of wanting to talk about something. So they will really just not talk about it. And of course, flashbacks or, re-experiencing what that happened. So sometimes a patient told me that she would just keep imagining like the cut of the knife when she had a C-section, or she would just hear the beeps and the screams and the cries of the baby when the baby was finally taken out. I mean, all these things are what they kind of live through over and over again. And if it happens so much that it affects their ability to kind of focus on their tasks, being their mom and being present for the baby, I think that's when it may be time to seek help.
We also have mummies who sometimes find it difficult postpartum to then experience periods, like menstrual periods.
Correct,
because like the pain might remind them of their experiences of labor, or like they might start to lose trust in their body as well. That's also quite typical.
Yes, right? And just a fun fact for mummies, after you have babies, your periods get heavier usually. So that is another stressful point about having babies. But yes.
What a sacrifice.
It is a sacrifice, isn't it?
It is a sacrifice.
Yeah, and I mean, I think the point about it is that, we have to talk about how much it is a sacrifice, because the media paints it as some amazing altruistic kind of thing that comes naturally, You
should have the mother instinct.
Exactly. I mean, your body is sure in a way biologically built to have children, but everyone is different and not everyone's boobs or everyone's womb is the same. And to put that unnatural, unrealistic standard on women right now, I think causes a lot of people to feel, that stress of comparison.
Like with birth plans, right? You talk about painful first pregnancy, and how traumatic the birth experience was. And oftentimes, moms then start to fear. And naturally, right? Like if they've been through such a painful delivery, a part of them will always fear the next time they give birth, will I have to go through that again? And how do you have any tips for how to manage that fear?
So I think fear is quite normal, especially when you anticipate something unknown or you've gone through a traumatic experience, as you said, and you don't know what to expect the second time. For most mummies, I think talking about it and seeking reassurance from people and getting the support that they require from their community or their village would be sufficient. Again, I think simple things like, doing breathing exercises, getting self-care in, doing exercises, Kegels. I mean, all these things can potentially support the mom. Talking about it to your obstetrician, I think is also an important part. And learning how to do things like breathe, yoga or Pilates also can help in that process. But for that group who really have truly had difficulties or very traumatic experience, or perhaps even a loss before the birth, I think that's something which really, if you feel as if you can't manage that yourself and you feel that you require someone to talk to, please look for someone through either, again, the Clarity Family Service Centers, psychologists, and really just share that. And sometimes, again, that catharsis is something that helps to kind of, heal some sort of that hurt.
What kind of therapies options are there out there?
So apart from the usual kind of supportive work, which I think for most moms is really quite the most important part, I think there's also different types of therapies that involve the individual as well as maybe the couple or even the family unit. So for the individual, apart from cognitive behavioral therapy, certain times it's like breathing exercises or
coping strategies,
coping strategies. Sometimes there may be more important things to deal with, like attachment or even their childhood, that may be done for patients with what we mentioned with OCD or the post-traumatic stress disorder as well. Then may more specific therapies to that condition may be required. But I think for the larger part of it, sometimes marital counseling or even family therapy may be important. And this is usually when there's maybe a communication problem amongst important parties of the village. So those may be called in combination with individual therapy or sometimes standalone.
I was just about to say both can happen concurrently.
Yes, they can.
Right, but both therapy would then be addressing different aspects of the struggle.
Yes, but I think with everything that comes with parenthood, sometimes even going for the therapy.
Like no time, right? Yes.
Correct. So I think that's a perennial problem. So I don't have a good solution for it, but I would say that if you feel that it's important and you can prioritize the time to sort it out, sometimes short-term pain brings long-term gain.
Maybe just to give our listeners an idea, how does all these services come together to complement and support a mother who's going through postpartum depression or postpartum conditions?
That's a good question. And I think that the main thing to understand is that most mummies who experience some sort of distress or unhappiness would really fall in the realm of normal, right? Wellness, it's about sometimes feeling very stressed, sometimes having sleep deprived, sometimes having a conflict with your husband or your in-laws or even your own parents. So for wellness, I think generally resources like going to the baby bonus website and looking at like what is normal, what should I expect,
it's the practical help as well.
Practical help.
Information is available.
Exactly. Or even speaking to friends or people that you respect, that would be sufficient help, at that level. Of course, beyond that help, where sometimes there's a little bit of acute stress or things that they really need to have, some additional advice, then of course, I think family practitioners, people in polyclinics, there's a health mind clinic there as well, going to a developmental screen with your child and asking the GP who sees you, or even calling services like Clarity or family service centers, that would be the next tier. Then, of course, there will be those who require a little bit more help. And that's when, the distress is more significant. It's impacting relationships or impacting their ability to even care for their child. Then that may require specialist help. And specialist help would then be psychiatrists across the country. Of course, KK and NUH being very big providers. It could be private psychiatrists, IMH. Regardless, then that specialist help may be required for a short period before most patients can get, sent back into the community and kind of go back to normal day in life. Where some people may then continue with services in the psychiatric clinic.
And sometimes what we see also is like both can go hand in hand, right? Like pharmacotherapy, when you see your psychiatrist, you can also be seeing a therapist at the same time.
Of course,
Right? And then where there's a more dedicated space to hold you as well as to hold space. Like for all the thoughts and difficulties or emotions that comes up.
And actually, when most people come to see me, I tend to suggest other more practical support first, then maybe perhaps therapy and in some cases medication. So I think there is a fear for many of my mummies who will come and say like, oh no, do I have to immediately start medication? And yes, it may be necessary and it may be recommended in some cases, but many times it's really just practical support that does the trick.
On the topic of medication, a lot of mummies also ask, like, I don't want to take medication, I don't want to harm my baby, if I'm breastfeeding, will it affect my baby? What we like to tell them, come. Because if I say, they'll be like, oh, are you sure? Okay, let's hear it from you.
Okay, so I would say generally for mummies out there listening, really medications now in general are prescribed and they are relatively safe. And these include more or less the antidepressants that are being used nowadays. And for patients who require like sleep medications, in terms of like running nose medicine, that's pretty safe. There are some mummies, of course, who require more specialized care, and some of them may experience more severe mental health conditions. And for those, if you do require things like the antipsychotic medication, which are those that help to control things that maybe coarse voices or more severe illness, those generally are also relatively safe. So I would say that doctors will err on the side of being cautious with your doses of medication. They will definitely look through and ask and consult to make sure they're prescribing pregnancy and breastfeeding safe.
Yeah.
But of course, if you're unsure, you can always speak to the pharmacist who's dispensing the medication. Yeah.
So all this we have gone into the consideration of
course,
the doctor.
yes.
Right. So don't be worried to speak to seek help. And if you have any concerns, just raise it up and have a discussion with the doctor.
Yeah.
Right?
So I think in having that discussion with your partner, with your doctor, would be important.
The partner is important.
But I think if, let's say, the doctor does feel and really highly recommends it, please do take that into consideration as well. Because I think our preset as doctors would be, we try not to prescribe the medications for mummies who are breastfeeding and pregnant as much as possible already. Yeah.
Thanks for sharing that. And we were talking about depression and anxiety, right? When these thought spirals, the one that I illustrated earlier, because it's quite a common one, tend to spiral and sometimes they become like depression. Some mummies actually then report concerns about like taboo things. Like for example, I just really don't want to wake up tomorrow. I don't think I would kill myself because someone has to feed the baby. But I really don't think if given a choice, I would want to wake up the next day and continue this whole thing again over and over. All right. Sometimes they also tell me, sometimes I just wish like my baby don't exist. Right? Because then all this would go away, right? And it's not because they are rotten people at the core, although they often think of that themselves.
They do feel that
they
way.
do feel that way, right? But it's not.
I've experienced some of these thoughts myself, feeling like, you regret, having the extra child, or you're not sure whether you've done the right thing or whether you'll be a good mother. Sometimes wondering like, I just I want to just like throttle my baby. I think those are very normal experiences. Again, when we talk about what is normal and what is abnormal, the abnormal comes when it happens a lot, when you cannot distinguish that it's a fantasy in your mind but it's not reality. When you feel so ashamed to talk about it, that it eats you and it affects your ability to have fun, to laugh, to rejoice in the small things in life, to be able to do the tasks that you need to do as a mom. So I think again, it's about when it starts affecting function, then that's when you really need to seek help. But if it happens once in a while, that is quite normal. So I have patients who will tell me like, I walk past my what do you call it? Mum brain again. Railing, the HDB railing.
Yes.
Yeah, and then they will say, sometimes I just fantasize, what would it be like if baby jumped? Not baby thrown, or what would it
if
be
I
like
drop my baby,
I fall down. And
that.
Sometimes, that's a significant indicator of stress, or you just being overwhelmed or sleep deprived. And if it happens once in a while, then that's something that you can just say, I'm going to monitor it. Maybe I'll just share it with my partner. But if it happens a lot, then I think that's when you need to maybe call a counselor, speak to Clarity, go to a polyclinic and just talk about it.
Yeah, and when you seek help, when you seek professional help, like some of the things that we look out for is also like the intent, right? Or whether they subconsciously did it before, like catch themselves, like maybe like holding a pillow over the baby, and then they suddenly, well, what was I doing earlier? Like those are very clear red flags. What are other red flags?
So I think red flags,
do you encounter?
I mean, red flags, of course, is obviously things like self-harm as well as harm to the baby would be there. So again, as you mentioned, if they catch themselves in the steps or really fantasizing about it or thinking
in
about
a lot of details,
or
making plans to do it,
they start feeling that life is meaningless and life is hopeless, that it's better for them and baby not to be there, and it's a almost constant thing. If they start alienating themselves from other people, so one of my patient's spouse told me it was almost as if she was a different person, and that joy was like sucked out of her. So it's these kind of like pervasiveness, constancy, that indicate red flags. I think another part of it, which we didn't talk about, is this concept of postpartum psychosis or puerperal psychosis. It's very rare and hence it's not really talked about as much, but postpartum psychosis is when sometimes the hormones, the sleep deprivation causes moms to lose touch of reality. So psychosis is when there's a loss of touch of what is acceptable through cultural and societal standards, and there's may involve hearing voices. So sometimes they may hear things like, someone's going to take your baby or something's going to happen. It may involve kind of unusual thoughts or ideas in their head. For example, oh, my husband or my in-laws are trying to kidnap my baby, or they're unsafe, someone's trying to poison them. And that distortion of perception and reality then causes them to be very fearful and distrustful of the people who they normally would feel comfortable with. And that also puts a strain on the thoughts of who is safe. And once that paranoia and suspiciousness kind of hits in, I think that's when it's at the biggest risk to baby and mummy. Of course, there can be different variations to it, but I think that's the most common thing that we see now. It is one of the leading causes of baby's death, especially when mum and baby are killed at the same time. Now, I think the main part about that is that it can happen very fast, usually within the first few weeks of birth. And there's a really sudden switch, a loss of who they are as a person and becoming dazed, perplexed. Sometimes they seem confused. And if you see that within a new mom, that is an instant red flag sign. And that one you really need to just bring to the emergency room. Regardless of which emergency room, as long as it's a restructured hospital, eventually after they assess, they may still then bring back.
The priority really is to make sure that the mom is safe first. Then we can talk about what kind of help and support is needed after that. Right?
So mom and baby being safe, I think is the key fact there.
Yeah, definitely. And how do you differentiate thoughts of fear of harm, like fear of harming the baby, from thoughts of like psychosis?
I would say that again, it's about pervasiveness, or how frequently it comes, how often it comes, whether you realize that it's a worrying thought or whether you think that is reality. Those will be the two main ways that we differentiate between like a normal thought versus something that is really held firmly in belief and unusual and risky.
Right. And in these situations, it's then very important if you're a father or if you are a mom or know of a mom who is struggling, it's important for you also to know the signs, right? To know when a mom that you might know needs help.
And I think while certain escalations can be through the various means that we talked about, meaning our community, circle of friends, our family, family practitioners and all, in certain instances where there's a sudden and very abrupt change of a person's behavior, sometimes the best option is really to bring them to a hospital for an assessment.
Just err on the side of error, right?
On the side of caution.
Oh, sorry. On the side of caution. That's right. Thanks for catching that. One of the things that came up earlier, right? Or like one unusual, or rather a thought that some moms struggle with that they might think is unusual for them to have is the idea of resentment.
Oh, yes.
Right? Indeed. Like I resent my child. Like I don't really want this child. On some days, mummies have told me, I just really wish I don't have this child anymore. Right? How do they cope with that? Is this common?
I think it is a very common feeling, and I've experienced times where I've disliked or resented certain things. But I try to tell my moms that we kind of split it into the love and the like again. I think most moms existingly do love their child. There may be some times where the love is more prominent and obvious, and there may be times where it really is not something that they're always thinking about. Especially for moms who are struggling, who don't have a good support, who have to work 2 jobs and are dealing with everything themselves without a helper or a good relationship with their in-laws. Sometimes that can be at the back burner. But acts of love would be things like, preparing the food for the children and all of those. And that's a clear indication of the sacrifice they're putting in. So what I tell my moms is that is your love. But like is like what we like, which is sometimes you're happy or unhappy with a person. Sometimes you are displeased with what they do or how they act, whether they're rude, whether they criticize you, whether they're ungrateful, which is a very common thing sometimes. And those things then breed resentment. But to address that would be then really, again, putting aside that thought of, I don't love my child, but trying to say, okay, do I love my child? If I do love my child, then is it that I don't like what they're doing? And if I don't like what they're doing, what can I do to solve that problem? And then getting help and talking about it. Because again, sometimes there is no clear solution to a problem, especially if a child may have developmental issues or perhaps behavioral issues. Or maybe sometimes it's like some children are a little bit more difficult to handle. Then there may be genuine issues that are causing this resentment, but just maybe different sources of help.
And this same concept, right, differentiating between love and like, can also be applied to your village and to your husband.
Yes.
As well.
Correct.
Especially in the initial phases when you're trying to work out or update, the routines at home. Even within partners, there can be a lot of friction.
I do want to point out that there are some moms who really truly may not be able to feel that love to their child.
Oh, yeah.
Sometimes that happens when the mom herself has experienced a really difficult childhood. Sometimes when there's trauma associated. Because having a child yourself and birthing in such an intimate way then also kind of reflects on their own past traumas. And if you don't have the capacity, or you don't really feel you can love your child, I think in that moment where you're trying your best to do whatever you can still for the child, seek help. Maybe therapy might be able to help you. Maybe some medications may help that journey. And then, take the opportunity to then see what kind of relationship you can establish. Because again, it's not possible to expect that all 100% of moms will love their children.
Yes. And how that love will look like will also differ from mom to mom.
Yes.
Right? Especially when you have gone through a difficult childhood. I have also mummies who shared with me that sometimes when they are trying to parent their child or they are trying to love their child, they are also grieving at the same time. Right? Grieving for a childhood that they didn't have, grieving for a love that they wish they could have experienced when they were younger. And all this can get in the way of how you experience your attachment with your own child as well.
Yes, I think those are very true, and really you do see that. We do feel that in these instances, again, sometimes just talking about it helps to heal some of the past hurts.
Yeah, I would really like to address the topic of paternal mental health. Like we have started conversation on maternal mental health, but the fathers, right, they experience stresses of their own, and it's often very much, even more so, like unspoken about.
Yeah.
What has been your experience?
So I would say, the stereotype of men is usually that they are very brave,
big, strong,
they're big, strong, manly, and they don't really talk about emotions. And I think when it comes down to a change in the marital relationship, being the center of your romantic partner's world to having these small little things kind of taking up most of the time, it just changed the marital dynamic quite a lot. Definitely. And I think the father then being like, okay, I see my wife, trying to do all of these things. I should just not talk about it. I should just try to hold it on and try to, move on from that. It sometimes causes them to feel that adjustment as well. It is also very stressful for some husbands to see their wife suffer through the pregnancy and the postpartum.
And not knowing what to do.
Not knowing what to do. Yeah. I think that helplessness then gives them that feeling of like guilt, right? Am I a good husband or father because I can't really help the situation that's going on? So I've had fathers or friends, come to me and call me and say like, what can I do? I feel so helpless. Yeah. So I think it's important to have that conversation with partners, and it's important for fathers as well to talk about it if they do need help.
Yeah. And sometimes also important for fathers to know that just because you can't fix something doesn't mean that you're not helping, or doesn't mean that you're weak or you have failed in your duty as a partner.
Yes. Right. I think it's about asking what the other person might require and what helps them feel better. So for example, when I have a really, really bad day, my husband will come up to me and say like, okay, what can I do to make it better?
Yep.
So sometimes I'll be like, okay, just take the kids for a while. I just need my space. Or sometimes I'll be like, can you get me a drink? He knows that I love bubble tea. So not sponsored by bubble tea company, but I love bubble tea. So he'll say, okay, can I get you bubble tea instead? So it's all these small little acts of service and like small tokens of care and concern that really do help. Sometimes it's not a big solution.
Yeah, it's not so much about what you do, but how you ask and how you attend to it, right? That keeps the bond and relationship going. Right. We are actually approaching to the end of this episode. I wonder if you have any words of wisdom or encouragement for a mother who may be feeling really dark or feeling like there is no hope left in the world, right? For the mom that still wakes up wishing that she didn't have to or didn't want to, right? Do you have any words of wisdom or encouragement for them?
So I would say to those mummies who are experiencing what you've said about not feeling that you can love your child, or feeling like, there's really no joy in this parenthood journey that you are on. Perhaps what you need more is not more of yourself, but more of help. And help can come in various ways. Help can come from, people who may not know you but are willing to chip in. Help can come from the school teachers who may be able to help a little bit here and there. Help may come from our family service centers who can afford subsidies or even things like vouchers for groceries. Help can come in clarity or a psychiatrist or any type of psychologist. Help can come from religious sources or even spiritual sources as well. So help is, I think, probably the thing that you require. And if you need help, just ask and someone will try to help you. If you're not sure, you can always approach any of our organizations and we will try our best to point you to the right direction.
Right, there are always resources out there, and in the process of searching for the right resources for you, do know and remember that you're not alone in the process. Reach out to any of our organizations or any of the members that Gillian listed earlier, and I think all of us would be happy to journey with you on this journey to find the help that you need. Thank you, Dr. Gillian. Thank you, Gillian, really, for taking the time out to share with us and having such heartfelt conversations about your own personal experience as a mom, as well as from your professional capacity. We have actually come to the end of this episode. We hope our conversation has inspired you to reach out and connect both to yourself as well as your village. So in the meantime, remember that doctors, counselors, social workers, and of course, Clarity is here for you and your motherhood needs. So we are here to be a part of your village when you need it, whenever you need it. So scan the QR code to find out more. We have only just begun to scratch the surface of this roller coaster that is motherhood. So let us know your thoughts on this series or if there are any other topics you wish to hear more about. So remember to like, subscribe, and share this video with a mom or a village member who needs to hear it. Okay? See you next time. Bye-bye.